Inguinal canal. It is an oblique canal situated in the lower part of the anterior abdominal wall above the medial half of the inguinal ligament. It is about 4 cm long and extends from deep inguinal ring to the superficial inguinal ring. Deep inguinal ring. It is a oval shaped gap present in the fascia transversalis and lies about 1.25 cm above the mid-inguinal point. It is a oval shaped gap in the fascia transversalis and lies about 1.25 cm above the inguinal ligament, that is the midpoint of the inguinal ligament. Superficial inguinal ring. It is a triangular opening present in the aponeurosis of external oblique abdominis muscle, and it lies above and lateral to the pubic crest. This is pubic tubercle, this is pubic crest. So this superficial inguinal ring lies above and lateral to the pubic crest. Boundaries of inguinal canal. It has an anterior wall, a posterior wall, a roof and a floor. The anterior wall is formed by skin, superficial fascia and aponeurosis of external oblique abdominis. The posterior wall is formed by fascia transversalis. The roof is formed by internal oblique abdominis muscle and transverse abdominis muscle. The floor is formed by the medial part of the inguinal ligament. How to remember the boundaries without by hacking? See, the anterior abdominal wall is made up of the following structures from superficial to deep. Number 1, skin, then superficial fascia, then external oblique abdominis muscle, internal oblique abdominis muscle, transverse abdominis muscle, and finally fascia transversalis. So the anterior abdominal wall is made up of 6 layers. Out of this, skin, superficial fascia and aponeurosis of the external oblique abdominis muscle forms the anterior wall of inguinal canal. The internal oblique abdominis and transverse abdominis muscle forms the roof of the inguinal canal. Finally, the fascia transversalis forms the posterior wall of the inguinal canal. The remaining one which you have to read is inguinal ligament, which forms the floor of the inguinal canal. That is the medial part of the inguinal ligament forms the floor of the inguinal canal. Inguinal hernia. Inguinal hernia. What is inguinal hernia? A protrusion of abdominal viscera, that is intestinal loops, through the inguinal canal is known as inguinal hernia. It appears like a pear-shaped swelling above and medial to the pubic tubercle. There are 2 types of inguinal hernia. Number 1, direct inguinal hernia. Number 2, indirect inguinal hernia. See, in direct inguinal hernia, the hernial sac enters the inguinal canal by pushing the posterior wall of the inguinal canal. Whereas in the indirect inguinal hernia, the hernial sac enters through the deep inguinal ring. So that is the first difference. Okay. The shape of the hernial sac is globular in the direct inguinal hernia, and it is pear shaped in indirect inguinal hernia. The neck of the hernial sac is wider in the direct inguinal hernia, and it is narrow in indirect inguinal hernia. Okay. Extent. The hernial sac directly extends into the scrotum in the indirect inguinal hernia, whereas it rarely enters the scrotum in case of direct inguinal hernia. In the direct inguinal hernia, the hernial sac passes medial to the inferior epigastric artery. See the opening, it passes medial to the inferior epigastric artery. Whereas in case of indirect inguinal hernia, okay, it protrudes or passes through the lateral to the inferior epigastric artery. So in direct inguinal hernia, the hernial sac passes through the Hazelback's triangle, whereas in case of indirect inguinal hernia, it does not passes through Hazelback's triangle. Direct inguinal hernia commonly occurs in old age due to weak of abdominal muscles. The indirect inguinal hernia occurs in young age and occurs in male more than female. So this is the difference between direct and indirect inguinal hernias. I told you it passes through the Hazelback's triangle in case of direct inguinal hernia. What is Hazelback's triangle? It is a triangle present in the posterior wall of the inguinal canal. What are the boundaries? Okay. So this is the triangle. Hazelback's triangle. The medial wall is formed by the lateral border of rectus abdominis muscle. The lateral boundary is formed by the inferior epigastric artery, and the base is formed by the inguinal ligament. This is Hazelback's triangle. So the protrusion of hernial sac passes through the Hazelback's triangle in direct inguinal hernia. It is not passing through the Hazelback's triangle in indirect inguinal hernia. Thank you.